continuing on here in chapter 21, still talking about our cardiovascular and lymphatic diseases. So now we're switching into the difference between hemorrhagic and non-hemorrhagic fever diseases. So first of all, hemorrhagic, these are agents that infect the blood and lymphatic vessels. They cause extreme fevers, hence the name hemorrhagic fever disease. But this is also accompanied by internal hemorrhaging, so the loss of blood. These are caused by RNA-enveloped viruses, and they disrupt clotting factors, which is what allows the bleeding to continue. They are all distributed through the Aedes mosquito, so the prevalence is actually fluctuating due to global warming patterns. So as we see here, typically in micro, we don't talk a lot about, climate change or geology or anything like that. However, because of some of these diseases being transmitted using vectors like ticks and mosquitoes, as our climate changes, it will impact where we start to see diseases. And as you can see here, the difference in the 2000s compared to the 1950s, we start to see more and more of these develop kind of here just above the equator as the temperature increases and these mosquitoes become more prevalent because that is their preferred habitat. Now, unfortunately, the projected difference as we look into the 2050s, we're going to start to see more and more of these diseases because those mosquitoes are going to have a much better habitat that they are used to in the climate that they enjoy as the temperatures continue to rise. Now back to our hemorrhagic fevers. We're not going to go into a lot of detail about these. I just want you to kind of know which fevers are hemorrhagic and which are non-hemorrhagic. I'm just kind of giving you a little information about where these are seen. Thankfully, not a lot in the US yet. But again, as that climate change continues and the temperature continues to increase in the United States, these will become more prevalent as those vectors come our way. So our list of hemorrhagic fevers, so we have yellow fever, dengue, chikungunya. Now this one is starting to come into the US of all the ones that we're talking about. And just to show how prevalent and how quickly it can spread. So in 2014, it came to the US and it went from 0 cases to over 1.7 million in just 3 years. So again, once these come into our area, they are going to become something that we see more often. Ebola, which causes, in case you haven't seen any pictures or heard much about this one, again, these are hemorrhagic, they cause bleeding. This one is so intense and those capillaries become so fragile that the patients actually start bleeding from all of their orifices. And it's thought that bats are the likely natural reservoir, so decreasing and limiting exposure to bats is one way of preventing this from spreading. And then the Lassa fever is our last one. Again, I included just some information about where these are endemic, but again, as we'll see, these are going to likely become more of an issue in the United States over the years. Now, the non-hemorrhagic fevers, as the name implies, they're still leading to a high fever, hence the name fever disease. However, the difference is that it does not lead to that fragility of the capillary, so it doesn't cause the bleeding that is seen with the ones we just went over. Now, most of these actually are caused by bacterial species. There is one, though, that is caused by a protist. And again, our list here, we're not going into a lot of information about these. I'll highlight a few of them, but I do want you to know which ones are non-hemorrhagic fever diseases. And again, all of these here are caused by bacteria. So brucellosis, Q fever, cat scratch, trench ehrlichiosis, anaplasmosis, and spotted fever, rickettsiosis. So again, highlighting just a couple of those, brucellosis. So this causes what's referred to as Malta fever, undulant fever, Bang's disease. All of these mean the same thing. They're just been some different names over the years. Brucella is a gram-negative coccobacillus, so it's like half circled and half rod. Now, what's unique about these as far as their virulence factor and why I wanted to mention them is they actually live in phagocytic cells. So remember, part of our immune system gets detected, phagocytes engulf them, chop them up into pieces using lysosomes, and then get rid of them. Well, their virulence factors actually live inside of the phagocytic cell, and that's what they use to kind of hop around through the bloodstream. Then they cause lesions in the liver, the spleen, bone marrow, and the kidney, because again, they're not destroyed by those phagocytic cells, but they're actually using them to get where they want to go. So the most prominent manifestation is this fluctuating pattern of fever, which is why it was also called undulant fever, just kind of spiking and going down, spiking and going down. Now, cat scratch fever, this one is more common to the US, so why I wanted to mention it. It's caused by Bartonella henselae. This is a gram-negative rod. It's fastidious, just meaning it can grow in multiple locations with different food sources. It can also grow on blood agar. Now, the infection comes from, hence the name, from being bitten or clawed by a cat because it's present in about 40% of all cats. Again, it doesn't harm them, but it can be transmitted then to us. So after, it does take a little bit of time for the incubation to occur, about 1 to 2 weeks, but it leads to small papules. Again, back to our skin diseases and our terminology there. Those papules that occur, we can see one here that's forming, then the lymph nodes start to swell and become filled with pus. And about 1/3 of those patients get that high fever, which is why it's listed here as a non-hemorrhagic fever disease. Now, one that is probably the most of all the ones that we're talking about, the most prevalent in the United States is Rocky Mountain spotted fever, mainly in the southeast and eastern seaboards of the U.S. along essentially the Americas, so Canada, Central and South America, but on the eastern seaboards. So caused by Rickettsia rickettsii is a causative agent. It is transmitted by the ticks, like we had seen with Lyme disease. So the symptoms, again, chills, fever, muscle pain, and then similar to Lyme disease, it causes a rash, but it's distinctive in the spotted, so not the bullseye like we'd seen with that, but this distinct kind of spotted, hence the name Rocky Mountain spotted fever, that occurs a couple days after infection from that tick. Now, one that is not so much a problem in the United States, another disease here, but is unique, is malaria. So this infects and causes problems, especially in Africa. Is a huge problem for their health conditions. Now, signs and symptoms take a couple days, 2 to 3 days. So malaise, fatigue, aches, chills and fever, some sweating, a couple different forms here. So falciparum malaria, this is a persistent fever with a cough, weakness for weeks without relief. And then cerebral malaria, this is cerebral, thinking about the brain. So the small blood vessels of the brain become obstructed, and this can lead to a coma or death. Now, this is caused by a protist. So again, we don't talk a lot about protozoan diseases, but this is one that does have a huge impact. So these are Plasmodium species. There's Apicomplexans, and these are ones that live in animal hosts. They don't have locomotor appendages in their mature state, so they don't have a flagella or anything once they're matured. They have an asexual and a sexual phase. The asexual is carried out in humans in their blood. Their sexual phase is by those mosquitoes. So it is transmitted by mosquitoes, so controlling mosquito populations as a way of controlling this disease. It is mentioned here there are multiple types of Plasmodium Plasmodium species that all lead to malaria. So the pathogenesis and virulence. The merozoites. This is just one of the forms of the protist. So as it moves, it has like a feeding stage and a sexual stage. So it's different. It's still talking about the protist here. So it can invade red blood cells and cause them to release those pyrogens, the fever-inducing chemicals. That's what leads to the fever. It uses glucose at a high rate, so it sucks up glucose from our stores. And then the damage to the red blood cells causes anemia because then we're less able to transmit oxygen, so it looks like they're anemic. And then the accumulation of those products in the liver and then some of the immune complexes in the spleen can damage those organs. Ability to attach to those red blood cells in the vessels in the brain also adds to the virulence. It can cause neurological problems. And it has antigenic variation, just meaning it can change through mutations. It can change the different proteins on the outer surface, so our immune system is less likely to be able to recognize it for long periods. So again, lots of virulence factors here that allow it to cause disease. Now the transmission prevention, a little bit about the epidemiology. So again, it is transmitted by mosquitoes. That's where the sexual phase happens. So taking care of mosquitoes helps take care of malaria. Now, as you can see from the graph over here, this is mainly, again, Africa especially is hit hard by malaria, the northern part of South America, and then some parts here of Southeast and Southern Asia. So in the United States, again, because of the mosquito population and the climate that they need, it is not very prevalent in the US unless there's traveling to those areas. Again, if we think about climate change, though, it is likely that over the years, as our climate continues to increase, that malaria may become a larger issue in the US. So working with the mosquitoes, so getting rid of standing water that they prefer, using insecticides, introducing sterile male mosquitoes into the population can decrease the overall population, using nets that we see down here, screens and repellents, as well as looking at human traveling. So again, while it's not endemic to the United States, as there's more travel to these different regions, it's able to bring that back. So prophylactic treatment for travelers, just meaning treating them with antibiotics or treating them with antiprotozoans before they travel so that they don't get the disease while they're there. And now there's even a vaccine that's showing promise for children in the endemic areas, like, again, Africa. Again, not approved yet, but it is showing promise. So again, our table here, so again, the Plasmodium species, again, these are protozoan, not bacterial, but they do need the mosquito, and it can be transmitted vertically, so from mom to infant, for example. Again, lots of virulence factors, so it does have different stages, like the merozoite, the trophozoite, different stages of its life cycle. So that allows it to change the antigens that are on the cell surface, so our immune system's less likely to keep up. It uses up our glucose. It produces some toxins as well. Again, our prevention, controlling those mosquitoes, as well as prophylactic antiprotozoan agents. And treatment is available for these. Again, it's not an antibiotic because this is protozoan, but there is combination therapy and antiprotozoan medicines like artemisinin that can be used to treat it. All right, the last disease that we're going to talk about here in this section is HIV. So this is a retrovirus, so we'll go into a little bit more detail about what those are and how we can treat them. But HIV, of course, leads to AIDS, which is acquired immune deficiency syndrome, because it destroys essentially our immune system. So it has a complex set of symptoms that changes. So pneumonia can occur, other opportunistic infections. This is really one of the biggest issues with this. So as the immune system essentially is depleted by the virus, it allows those other pathogens, those opportunistic pathogens, that are normally kept at bay, it allows them to cause the disease. So lots of different opportunistic infections like pneumonia. Cancer can even be developed from this. So Kaposi sarcoma can result sudden weight loss, swollen lymph nodes, and just that general loss of immune function due to the destruction, especially of those cytotoxic T cells. Now the causative agents, so the retrovirus genus is called lentivirus. Again, this is a reverse or retrovirus. So the virus needs to contain what's called reverse transcriptase. And this is going to allow replication of DNA from RNA. So again, normal transcription and translation, we take double-stranded DNA, we make single-stranded RNA, and then that RNA is used to make a protein. Well, in these retroviruses, they are RNA viruses, but they have an enzyme called reverse transcriptase, as we'll see in the next slide, that allows that RNA to be used to make DNA. And then DNA goes through transcription and translation to make those viral particles. Now, the viral genomes can permanently integrate. So once that double-stranded DNA is made, it can actually become part of the host genome. And that's what can lead to those cancers like the Kaposi sarcomas. And again, due to that integration, it can lead to other issues as well. There are two types of HIV. So one is the most dominant. That's the one that we typically talk about. And it's most related to that immunodeficiency, also in chimpanzees, which is where it was originally thought to originate. And then that host strain was able to transmit into humans. Again, typical multiplication. So again, we have an enveloped virus. Again, it's an RNA virus. So the RNA goes in, but using this reverse transcriptase enzyme, this RNA is used to make DNA. So once there's a single strand of DNA, then the complementary DNA strand is made. So we're ultimately going from an RNA to DNA molecule. Again, our cells don't have that. We don't have that, so they have to package that reverse transcriptase enzyme into that virus in order for it to replicate. Now, again, a lot of times we can get integration then of that DNA once it's made. It can go in and actually become integrated into the host genome. Again, that's what can lead to the development of cancer. But then once it's part of our genome, then just like any other DNA we have, it can go through transcription to make RNA and other proteins. So it uses our host cell to make more of its genome, that RNA, as well as the protein like reverse transcriptase and the capsid proteins. So then treatment for HIV and AIDS should begin immediately after diagnosis. Antiviral chemotherapy, again, we're not talking about cancer with chemotherapy, just chemicals used as therapy. So antiviruses, typically a variety of drugs can be used to prevent opportunistic infections, again, like the pneumonia and other complications that can lead to that decrease in weight loss. In addition, there's a 3-drug cocktail that combines reverse transcriptase inhibitors, and they just work in slightly different ways. But again, this can be a nice target because we don't produce this enzyme. So if there are drugs that produce this enzyme that cause this enzyme not to work, it can prevent replication of the virus inside the person. So again, how those work. So again, that reverse transcriptase, typically viral RNA is using that reverse transcriptase, is used to make single-stranded DNA and then double-stranded DNA. But using reverse transcriptase inhibitors like AZT is an example of them, it stops that reverse transcriptase from working, so it can't make DNA, and so it prevents its replication. All right, so our causative agents here, again, HIV 1 and 2, again, 1 being the most prevalent. So transmission through direct contact, so sexual transmission, but also sharing needles, so bloodborne or parental, through injections, and it can be vertical from mom to infant, either through during fetal development or even through breast milk, can be transmitted that way as well. Again, virulence factors, it's spike proteins that allow it to attach. The syncytia, which is where it causes our host cells to fuse together so it doesn't have to leave the host cell to infect another one. Again, that enzyme reverse transcriptase. And then what makes this really, really challenging is it has this high mutation rate. So whenever we think about creating vaccines that would, train our immune system to recognize it, the problem with HIV is that it mutates so quickly that vaccines that would recognize one protein, it's likely it would mutate, and then it wouldn't be effective anymore. So similar to like our flu, to where we get lots of strains and variations, again, HIV high mutation rate makes it really hard to treat. So that's why using combination therapy is the most prevalent form of treatment, using those antiretroviral drugs. All right, then our other slides here are just kind of summarizing our cardiovascular and lymphatic diseases, again, breaking down. So our spore forming, so we only had one here that we talked about with anthrax because it can form, that Bacillus anthracis forms those spores. Our bacteria, though, can lead to acute endocarditis. Our gram-negative bacteria cause different ones. Again, we're not going through individual, like what causes the plague or talluremia, or even the hemorrhagic or non-hemorrhagic diseases like Q fever. If I didn't specifically go into detail about them, you're not responsible for knowing these. But again, knowing that the diseases, whether they're caused by bacteria or viruses, is important, but not specifically which one unless we talked about it. So for example, we talked about cat scratch fever, so you do need to know that the Bartonella Hensley is what causes that. We did not go into detail though about ehrlichiosis, so you don't need to know specifically the causative agent for those. Then looking at our viruses, so DNA virus, so mono is caused by that Epstein-Barr, which is a DNA virus. Then our RNA viruses, so the COVID-19. Again, we didn't talk specifically about these, but those hemorrhagic fevers are mainly caused by viruses, non-hemorrhagic more caused by the bacteria. And then our retrovirus, of course, we just talked about with HIV and AIDS. And then finally, our protozoa. So again, malaria is really the only one we talked about here with those Plasmodium, but there are some others that are caused by protists as well. And then, of course, our nice summary slide at the end. So again, those non-hemorrhagic fevers mainly caused by bacteria. There is one protist in that group, whereas the hemorrhagic fever, they're caused by viruses. So another difference between those two. And then again, just looking, again, mono caused by a virus, COVID, of course, a virus, endocarditis, though, various bacteria that are causing that, malaria caused by that protist that we had talked about.